All right, well, how y'all doing? Thanks for being here today. I think this is an important step as the city continues to aggressively tackle drug addiction and the opiate crisis in our community. We're rallying together with the Department of Public Health and our friends at Primary One to provide needle drop-off boxes in our community. This is so important for the health condition of our community, for our children playing on playgrounds, for regular citizens taking a walk in a park where needles could be strewn because of the proliferation and how dangerous drug addiction is in our community, how pervasive it is, that we have a safe point to eliminate the access to needles once they are used. This is a wise investment in order to clean our community and make it safe for everyone. We have to accept the reality that folks are using needles, that drug addiction's on the rise, that opiates are a problem in our community. And with accepting that reality means that we have to have a place where people can get clean needles in order to stop the spreading of disease, and places where people can drop off needles, so that we can make sure we have a clean community for everyone, including our children, especially those playing on playgrounds and in parks in our community. So this is the second, if my understanding, the second box. The first box is on the Near East Side. It is on Mount Vernon Avenue, and this will be the second and a third one soon on the Hilltop. So these are focused on areas where we've seen drug addiction and the opiate use at its highest, and we are proud of the partnership with Primary One, with the Department of Public Health, as we implement the needle drop-off program, as we have our Project Safe Point and our Safe Point access programs, as we develop a model to educate about the dangers of drug addiction, and as we create a model that tackles drug addiction and provides the opportunity for rehabilitation, which is so important, and it's costly, but it's necessary in order to give people the hope and the opportunity they need to lift them out of the cycle of addiction that can sometimes breed the cycle of poverty and incarceration. So we're doing this for our Columbus residents, for our children, our families, and we're proud of the partnerships that we have. And I want to bring up my friend and our ally on this, Charlita Tavares, the CEO of Primary One.
Thank you very much, President. Thank you very much, President Klein. I appreciate the partnership, certainly with the City of Columbus, and most importantly with Columbus Public Health. Primary One Health is the oldest and largest FQHC in Central Ohio. We've had a partnership with Columbus Public Health since 1973. It's important for people to understand that we cannot do this alone. We have to have partners throughout the community in order to protect all of our residents. We are very fortunate to have the Reeves Center right down the street, and certainly all of our staff and the patients that come in our doors here at Primary One Health. What I want to reinforce is that it's not just about protecting those who use needles, legally or illegally. It's about protecting our patients, our staff who are here, and all of our community members. I see Ms. Wolf with the Community Development for All People, and their partnership is really important to Primary One Health and the residents of the south side of Columbus. Our patients need the services here. We provide comprehensive primary care, which includes behavioral health care. We also provide services for those who have addictions, medication-assisted treatment. That's important because we want those who have an addiction to know that we have this red box here, that they can safely dispose of needles and make sure that they're not infecting other individuals, not only with HIV, but also hepatitis C. And those who have other needle needs, those who have diabetes, who may need to dispose of their syringes, we have this red box for them as well. So I want to bring up our partner, our friend, and our health commissioner, Dr. Teresa Long, who has been a champion not only for the syringe and the exchanges and also the red box, but also for helping to save those within our community who have drug addiction. Dr. Teresa Long.
Well, good morning, and thank you, President Klein, for your leadership in many ways, but on this issue, it is so appreciated. And, of course, to our CEO of our key partner in this work, but actually in so much of our work in this community around both protecting health, but really health healthcare, improving lives. So again, to the CEO of Primo One Health, Charlita Tavares, thank you. So very glad you're all here, and very glad that this box is standing right behind us, because indeed, as Council President Klein said, our community is in the midst of an unprecedented got a lot of trucks, don't we? Our community is in the midst of an unprecedented epidemic of drug addiction and overdose that is being caused both by prescription medications, but clearly heroin and other synthetic drugs related to that. And there is something that all of us can do. Well, the solution to this epidemic, it's complicated. But we all know, and I hope you know, that we all play a role in this. Heroin addiction is a chronic relapsing brain disease that can cause devastation in families and clearly in neighborhoods and in communities that are already vulnerable. Addiction is not a disease of one's character, but of one's brain. We need to fight this epidemic as we would any other disease outbreak with a multifaceted public health approach that will help people who are already addicted get into the treatment, get into treatment and then recovery, and recovery happens. And yes, we want to prevent both children, all people, from becoming addicted in the first place as well. Punishment, stigmatization is not a cure for any disease, and certainly not this one. Our residents are suffering from this condition, this disease, and their families and our neighborhoods are all counting on us. So again, it is, as Charlene said, as a result of this epidemic that our city and county are also facing an epidemic of increasing hepatitis C cases, again, being spread in part because of infected needles or needles that are being shared between persons. So again, we want to address that epidemic as well. So if gone untreated, that hepatitis C can indeed be very serious and be fatal. So people who are injecting drugs, whether for legal or illicit purposes, they need a safe and secure place to throw away used needles. This safe disposal of these needles in this epidemic, of course, is critical, and thankfully, as a part of our Franklin County Opiate Action Plan that has really been in progress, but actually has been kicked off and shared earlier this summer, does include steps around this, including the placement of syringe disposal boxes. So we're very excited to be able to move the plan forward. And again, in the safe disposal, we know that individuals, whether they are using syringes for their diabetes, for other medical conditions, could be hormone, etc., or for substance use, heroin use, these syringe boxes are a safe place for disposal. I would also note that the most common disposal route actually is a safe practice, a very safe practice that we encourage, and that is really to use either needle boxes or hard plastic boxes that you may have at home. It could be a milk container. They can be wrapped up, they can be labeled and put in the trash. So again, this is the most common way to dispose of syringes, but these boxes are an addition, and they are an important addition because the usual practice may not always be feasible. So again, we want people to protect themselves, their families, their neighbors, and dispose of all needles safely. I would also note, as Council President Klein noted, that this is our second official box. Mount Vernon, now here, just off of Parsons Avenue. There will be another location up on the hilltop coming very soon. And actually, just in the next few days, there will actually be a new box appearing on the parking deck at 240 Parsons Avenue at Columbus Public Health. So again, we're very excited. There will be more. The plan calls for more. But these are important steps, again, to protect our residents and to actually ask all people to be a part of the solution. So I would urge you to get further involved, to learn, to volunteer, to donate, to do what you can, because indeed we are all in this together. And so with that, speaking of all in this together, I'd love to introduce to you Ms. Donna Bates. Donna has been a great partner and advocate on the South Side for many years. Donna?
Good morning, and first of all, welcome to the South Side, the great South Side. I want to tell you that we're excited as a civic and as Parsons Avenue merchants to have this box here. We've been concerned about the increase in opiate abuse in 43206 and 43207, and we think this is a safe way for us to keep our children, number one, safe, and our residents as well. Ironically, we are having a box installed near where the original John Maloney St. Stephen's building was located, which is over to my right. And we're very fortunate, thanks to Ms. Charlita Tavares, to be able to tell you that the John Maloney Center still carries that name, even though it's a primary one facility. So with that, I wanted to tell you that he was a compassionate person who worked hard on the south side of Columbus and throughout the city of Columbus, but we claim him on the south side. So I want to let you know that we as a civic, we on the south side, and I've been here for 70 years, trying to carry on the legacy of my mother, Carrie Garnes, to let you know that the first thing to do is to recognize that you have a problem, and we do recognize that. The other thing is to be compassionate and not be critical of others who have a problem. There was a quote I looked up this morning, and it said that you're not a drug, it's not the drugs that make you an addict, it's the need to escape reality. And some of the people in this area feel that they are hopeless. They feel that they are disenfranchised. So it's up to us as the community to encourage them to seek treatment and not to be critical. We don't know their circumstances. We have not walked in their shoes. So that way we can invite you and any community member to participate with us. We have a substance abuse committee that meets the first Monday of every month at the Reeb Center. We begin from 6, we try to end at 7:30. Try to. We have so many topics to discuss. And we all can make a difference. The thing is, on the south side, we've got so many great things happening between housing and healthcare. But more importantly, we've got the John Maloney Center and we've got the Reeb Center. So if anybody needs any resources, we hope that you will try to at least visit there to see what they offer, share that with your own committees, with your own churches, with your neighbors, and above all, remember there is never an opportunity that you should not take advantage of where you reach out to help somebody else. With that, I would like to, before the sprinkles get any harder, reintroduce our City Council President, Zach Klein.
Thank you. So this is an important step. As we do the opioid action plan and build our model for drug addiction and mental health treatment in our community, we're checking off the boxes under the 2017 action items, the 2018, with a serious focus on making a difference, of putting our money and resources where our mouth is so that we can build that model that's so necessary to tackle drug addiction generally. It's opioids today. We don't know what it's going to be tomorrow. And that's why we have to have a model built that addresses drug addiction and mental health generally. It makes our community safer, it keeps families together, and it builds a stronger sense of trust with our community and provides the health treatment that people deserve from a social aspect of people deserving to have a good life and a fair life to lead. So thank you to all of our participants, Dr. Long, Ms. Tavares, Ms. Bates, thank you so much. And we'll do one-on-ones if you have any questions, but thank you all for coming. Thank you.